It's very, very, very rare for someone who is not trans, even as a youth, to seek trans care. We don't want any cisgender kids to do things that they shouldn't be doing because they're not trans. But you can't just sacrifice trans kids or trans people because you don't think we exist. Stop treating trans people like we are confused or we're not sure, that we don't know ourselves. You're infantilizing trans people. Huge news out of the Netherlands, as reported by Aaron in the Morning, states that landmark official Dutch review recommends trans youth care, call for expanding treatment. The review finds that wait times must be shortened, that few people detransition, and that trans youth care has enormous benefits. This is in line with the science. There is no such thing as gender ideology. That's a made-up right-wing term. The science is very, very clear. I have tons and tons of links to the science. This is not propaganda. These are from universities, and some are from like YouTube channels and stuff, talking about 55 studies were reviewed in a meta-analysis. 80% of transgender kids detransition debunked. There's lots of propaganda out there in order to get people to turn against us when the science is very clear that we exist. In a landmark 2-year review, the Health Council of the Netherlands, the country's highest scientific advisory body, this isn't some random group of rogue doctors or some corrupt university or something like that, has delivered its verdict on gender-affirming care for transgender youth. The council's conclusions were universally positive for gender-affirming care. It endorsed the treatments as careful, lawful, and effective, framed quick access as a matter of the right to health, which it absolutely is for trans people, warned that doing nothing is harmful, as is backed up by the research and statistics, especially if you look at suicide rates. Transitioning does not increase suicide rates. That's based on a lot of propaganda and misinformation, studies that are taken out of context or that are just poorly done. And I know that's easy to say, but if you look at the overwhelming majority of evidence, it's not here's some support and here's some against. It's here's some support and here's some against. Cast aside the CAS review as not applicable to Dutch care because the CAS review is garbage. There's so many problems with the CAS review to begin with. In fact, you can click this link right here and it'll probably tell you all the terrible things wrong with it. And then the HHS report in the United States was based largely off the CAS review. It's a lot of propaganda. Further, the Dutch report reported 0 cases of regret among trans youth patients. 0 cases. 0 cases. The regret rate is actually about 1%-ish. Between like 0.4 and 4% at the most. And this is for trans people in general. That's lower than the regret rate for any other medical intervention. Heart surgery, knee surgery have higher regret rates than that. That's how efficacious this care is. And the review called the reduction of the country's years-long wait times morally urgent. Morally urgent. In doing so, the Netherlands becomes the latest in a series of European countries to reaffirm and strengthen care for transgender youth, refuting a right-wing talking point in the United States that Europe is pulling back. The review was commissioned in May 2024 in the wake of the CAS review. The Health Council's committee ran systematic literature searches and consulted outside clinical experts chosen for their differing perspectives on the care. Look at that. A list that included Hilary Cass herself. The panel was chaired by Olaf Dekkers, a Leiden University Medical Center professor of internal medicine whose academic specialty is research methodology, and seated professors of health law and medical ethics alongside practicing physicians and psychiatrists. Look at that. Big broad base. From that foundation, the committee dismantled the argument at the center of the American campaign against this care, that the evidence is too weak to justify treatment, answering that the evidence quality for trans youth care is in line with the norm across pediatric medicine, and that doing nothing carries documented harms of its own, pointing specifically to harms produced by America's own care bans. America is doing it wrong. We're doing it backwards. The Lemkin Institute has already declared that the United States is in the early stages of a genocide against trans people. Genocide doesn't just mean extermination. That's usually the last part of it. The committee concluded that the care is lawful and careful, and that it works as intended, stating in its summary, the committee concludes that somatic treatment for young people with gender dysphoria fits within the health law framework. It further finds that scientific research shows the intended physical effects are achieved, that there are indications of some improvement in mental outcomes, and that the number of cases of regret is low. In the committee's view, the current data on unintended physical and mental effects are not cause for concern. The American Academy of Pediatrics, on their website healthychildren.org, they discuss gender identity development in children. These aren't corrupt doctors or anything like that, How does gender identity develop in children? Around age 2, children become conscious of the physical differences between boys and girls. Before their 3rd birthday, most children can easily label themselves as either boy or a girl. By age 4, most children have a stable sense of their gender identity. During the same time of life, children learn gender role behavior, that is, doing things that boys do or things that girls do. However, cross-gender preferences and play are a normal part of gender development, hold that thought, and exploration regardless of their future gender identity. This is what a lot of people say. They say, oh, they're just maybe confused, they're just exploring, they'll grow out of it. But the point is that all children tend to develop a clearer view of themselves and their gender over time. At any point, research suggests that children who assert a gender-diverse identity, such as being trans, know their gender as clearly and consistently as their developmentally matched peers and benefit from the same level of support, love, and social acceptance. This right here is explicitly saying, yes, children will explore their gender, but trans kids and other gender diverse kids do exist because it is innate in the brain. Being trans is biological. It has nothing to do with sexuality, orientation, or anything like that. Even if it were a choice, that wouldn't matter. That shouldn't matter. Most trans people who live, into their 20s, their 30s, their 40s, their 50s, and you ask a lot of them, not all of them, but you ask a lot of them, they will tell you they knew from the age of 3 or 4 or 5, sometimes 10, sometimes 12, but many knew from a very young age. It's not confusion or anything like that. That idea that it's confusion comes from a patriarchal, cisgender-centric model that treats that as the norm, and any deviation from that should be treated with suspicion, as unnatural, as confusion. But if you actually accept and realize that trans people exist and that we're generally born this way, then you understand that it's just a thing. And the fact that regret rates are so low shows that it's very, very, very rare for someone who is not trans, even as a youth, to seek trans care. Standards of Care, WPATH, version 8. Okay, you can read this document. It's available. It's on the internet. Yes, I know the Trump administration is trying to go after WPATH and all this nonsense because they're attacking us. Okay, it's not because they're some crazy fringe radical extreme group. This is literally version 8. These people have been around for a while. Okay, this is established care, but everybody is trying to do anything that they can to try to debunk our existence. The advisor also rejected the framing that treating transgender youth as a risky intervention while not treating them as a neutral default. Delaying care, the review found, carries its own harms. Youth develop unwanted and often irreversible physical changes, some of which can only be undone later with surgery, while mental health suffers in the meantime, and some young people locked out of careful care turn to unregulated hormones on their own. It's just like trying to ban drugs or whatever. Like, you're just going to force it underground. The war on drugs, which is mostly just a racist thing to lock black people up to begin with, criminalizing certain behaviors that people are going to engage in anyway, doesn't solve anything. It's the same thing in this case. If trans youth can't get access to hormones or to the care they need, they have two options. They can either suffer until they most likely just, decide to check out, or they can try to get relief because, again, this is in the brain. It is biological. Gender is in the brain. And when it comes to puberty, unwanted and often irreversible physical changes, the argument for not using puberty blockers, waiting until you're 18 at the very least, it completely misses the entire point because you're forcing, as it says, you're forcing mental health suffering, massive mental health suffering. It is a living hell worse than death. I'm trans. I know. To be trans and to watch your body be forced through this natural puberty that doesn't match your brain, your sense of who you are, your wiring in your brain as a trans person, to watch your body go through that is traumatic. Like, you're scarring these people, these children, for the rest of their lives. It's painful. Some of them don't survive because it's that bad. Any other condition, like depression or something, we would say, oh, we need to get these people help based off of what the evidence shows, what the standards of care show. And this is what the standards of care show. We've tried treating it as merely a psychological thing for over a century, believe it or not, in the West. There's a whole history of that. You can check out Debunking Transphobia, link in the description, if you want to learn more. Yeah, it's a long-ass video, but this guy started off with the intention of disproving our existence, showing that gender ideology is crazy and gone too far and blah, 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 blah. And he ended up becoming one of our closest allies because of the research he did. There's lots of different stuff in here. It goes into like the people behind pushing all of this propaganda and nonsense, and who started the controversy with sports and bathrooms. It's all manufactured. What you're doing is you're saying, I want these kids to suffer because that's what's going to happen. There's no other option. We've tried everything else. You're saying, I want these kids to suffer. I want them to go through this horrible mutation, feeling gross, feeling like a monster, feeling like an alien in their own body. Again, you cannot look at this from a cis-centric lens. Just because trans people are a small percent of the population doesn't mean that we're an aberration or we're unnatural or anything like that. Redheads are a super small part of the population too. And yeah, historically, people have seen them as aberrations and devils and this and that, whatever, but of course they're not. Same thing with left-handed people. It's all natural. Just because it's a small percentage doesn't mean anything. Like, can you imagine if somebody argued like, oh yeah, well, there's only like 2% of the world population that has red hair, so that's an anomaly, that's an aberration. Most people have brown hair or blonde hair. That's the normal default. There's like one or two options, and that's it. And any variations of that are just not natural and should be stamped out and persecuted. It equally makes no sense. The committee's answer, in a passage aimed directly at that framing, calls the reduction of wait times a moral imperative. Non-treatment is therefore not a neutral option. In the public debate, treating is often presented as intervening, while waiting is treated as self-evident. From the perspective of autonomy, children, yes, they're guided by trained medical professionals. They ideally will have input from a parent, provided that the parent isn't, a hostile piece of shit, that they actually want the best for their children. So children do have some limited autonomy, but they're still part of the equation. They are still humans who will then develop into full autonomous human beings, and then it's going to be too late. Because certain changes have already happened, okay, and the trauma has already been inflicted mentally. From the perspective of autonomy, it becomes clear that delaying or withholding care also has consequences for young people's lives and their developmental possibilities, and that those consequences are morally relevant. From that perspective, shortening the wait times is morally urgent. This is medicine. This is science. This isn't ideology. This isn't some sociology or woke professors or anything like that. This is established medical science. They also examined rates of stopping treatment and of regret, and found both to be rare to non-existent, stating Dutch research shows that 0% to 3.5%, as I said earlier, this is basically what I said, of people with gender dysphoria stop hormone treatment that they began as minors. No cases of regret were found in the studies. The international picture matches across 5 systematic reviews. 5 systematic reviews. Not 1 systematic review, not 2 systematic reviews, 5 systematic reviews. How much evidence is enough for you people? 5 systematic reviews. Between 0% and 8% of youth stop hormone treatment, with regret rates described as low. Just because they stop hormone treatment doesn't necessarily mean that they have a regret rate. People stop transitioning for many reasons. Lack of acceptance societally, lack of acceptance familially in their family. Economic concerns because they can't afford the transition treatment. Those people who at some point stop transitioning, start transitioning again later because the reason they're doing it isn't because they're not trans. Among the Dutch youth who did stop puberty blockers, the most common reason recorded was that their gender dysphoria had resolved, an outcome the Dutch model counts as the system working, since blockers exist precisely to give young people time to explore. Not everybody who goes on puberty blockers will be trans. This gives children some time, because there is that small number of individuals who will fall into that actual legitimate regret rate, and giving puberty blockers, which are generally perfectly safe, to these children gives them that time so that we can keep that number ideally at 0. We don't want any cisgender kids to do things that they shouldn't be doing because they're not trans. But you can't just sacrifice trans kids or trans people because you don't think we exist or you don't think that we're as important. The committee also cautioned that stopping and regret should not on their own be read as a verdict on the care itself, as I said. noting that many forms of regret trace not to the treatment, but to discrimination and social hostility toward the people who receive it. It's exactly what I said. The review also documented benefits of treatment across several mental health outcomes: depression, suicidality, self-harm, and emotional well-being. Dutch trans youth report on average worse mental health before treatment with GnRH agonists than their cisgender peers. The review states, using the clinical term for puberty blockers, after starting GnRH agonists, they report better mental health compared with the situation before treatment. This applies to emotional problems, depressive symptoms, suicidality. We are not more suicidal after. We are less suicidal. What does it take for you to listen to the lived experience of people? For gender-affirming hormones, the committee found the limited research does show a significant improvement in general functioning and well-being after treatment. The committee then pointed out what delays cost transgender youth. A youth overwhelmed by distress about their own body or struggling with depression and social withdrawal, it wrote, has fewer chances to form an identity. And when we say identity, everybody has an identity. This isn't, oh, I choose to identify this or that, whatever. A lot of people misuse that term. We all have an identity, develop talents, and make plans for the future. This disrupts so much more than just, oh, they feel gross. Maybe they're a little confused. We should make them wait. No, this ruins young kids' lives, forcing them to not have access to this medically necessary care. Untreated gender dysphoria damages the right to an open future. You're harming the future for these people by trying to protect them. Get out of the way. Let the medical professionals do their job. This isn't controversial. The review directly engaged the argument that evidence-based medicine, a term that is often used by anti-trans people, and the grade rating system prove the evidence for trans youth care is too weak to act on. The grade tier that critics often cite measures study design, the committee explained, and in pediatric medicine, randomized controlled trials, RCTs, are largely off the table. Ethical thresholds for conducting randomized controlled trials are much higher for children than for adults. And in this field specifically, young people refuse to join a no treatment control group, and blinding is impossible when treatment visibly changes the body. A lack of RCTs has the consequence that the level of evidence will necessarily be assessed as very low. That places trans youth care on the same evidence tier as much of children's medicine. For many questions in pediatric medicine, the evidence is low and will likely remain low. For many questions in pediatric medicine, it's not just trans youth care. The committee writes, which is why evidence-based medicine, properly practiced, weighs research alongside clinical expertise and the patient's own individualized treatment goals. Especially these kids. Stop treating trans people like we are confused or we're not sure, that we don't know ourselves. You're infantilizing trans people. The review's recommendations mark the latest step in an unmistakable movement across Europe, the expansion of transgender healthcare. Not just for youth, for trans people, because we exist. For years, American coverage fixated on restrictions in the United Kingdom to claim the continent was turning back again. They're also attacking us. That claim was always false, as more countries affirm the importance of such care. Germany, Austria, and Switzerland issued joint guidelines recommending the care, while France's pediatric endocrinologists published their first national consensus endorsing it. Germany, Austria, Switzerland, France. And now the country that pioneered gender-affirming care for trans youth has reviewed the care and found it yet again that it gives those youth the greatest chance to thrive. Now the Netherlands joins that group. I know a lot of this is going to fall on deaf ears. There's probably already people who left some nasty comment and stopped watching. Thanks for the engagement, I guess. Stop hurting innocent children. It's your belief and your worldview against tons of well-established scientific data, clinical practice, the experience, the lived experience of millions. There's so many people in the world. Even if we're just 1% of the population, that's still millions and millions of trans people. It's just you guys do not want to believe that we exist and are real and are legitimate. That is a you problem. Science supports us. We just want to live our lives like everybody else. Keep rising and shine your light. The world needs you.
I did it all. I played pretend. I moved the mountains to be